Today I'm talking with Dr. Murali Naidu, the CEO of San Ramon Regional Medical Center and a former physician who's led hospitals through some of the hardest moments in healthcare, especially during COVID. And he's also deeply involved in education as a trustee at Head-Royce School. So, what really stood out to me in this conversation was how Dr. Naidu thinks about leadership, not just as running fluid systems, but more so as taking care of people, whether that's patients, students, or entire communities and employee systems at large. We talked about a lot of things in this conversation, from healthcare to AI to risk taking and being Indian American, and how to define yourself and success without boxing yourself into certain categories. So, this was a really good conversation, one of those conversations that makes you think bigger about what you can actually do with your life. And yeah, I hope you enjoy. To start things off, I guess, could you tell me more about what you do, what keeps you busy and excited right now?
Sure. So I am the CEO of a hospital, a health system, if you will, in San Ramon. I'm also a surgeon. I haven't practiced in several years now, but what keeps me busy is just keeping up with all the changes that are coming at healthcare and making sure that we're building an organization that's going to continue to be directed towards where healthcare is going. I'm not sure that we all know exactly where that is, and that's part of the art and the fun of it. But at the end of the day, we all need healthcare at some point, and that's going to be a constant. And so, to the extent that we can continue to do that well as healthcare changes, that's the challenge.
Yeah, you led a lot of hospitals during the pandemic. I guess, like, what is a moment from that time that sort of stays with you and then kind of influences that vision you were talking about with the future of healthcare and the future of like providing that and maintaining that system?
It really was right at the beginning of the pandemic. It was such a poignant moment because we had so much uncertainty. We didn't really know what the impact of this virus was going to be. We didn't know how dangerous it was. And therefore, we didn't know what risk we were taking and what the team was taking by caring for people that came into the emergency department really sick. We had to pivot to providing care in a way that was as safe as possible. And that meant doing things like all of a sudden putting a tent in the parking lot to be able to have patients that had any respiratory illnesses be taken care of out there to protect the other patients on the hospital side. We had to expand the ICU. We really made almost instantaneous, huge changes to the way we provide care because of both the uncertainty that COVID brought, and the fact that we're going to continue to care for people to the best of our ability. And that, to me, is so emblematic of the real value of our healthcare system. People who are in healthcare really care about taking care of folks, and you saw it at that moment. You saw it in 2020 when people were willing to do whatever was necessary. They were willing to take an unknown amount of risk to take care of people, going to work every day, showing up in the hospital when everyone else, most of the rest of the people in society, stayed home to be safe. It really spoke to how important the healthcare system is, and how important the people that do that work are. So really tremendous. Those doctors and nurses that came in every day, all of the people, environmental services or housekeeping, really, really pretty tremendous.
Definitely, yeah. So I guess it's all kind of united around like a sense of responsibility to the community.
And
Um,
caring, right? I mean, that's the other thing. It's a responsibility. It's a professional responsibility. It's an oath that physicians take. But more than that, it's just caring about humanity that makes it special and different.
how does that sort of vision kind of influence other things you do, like being involved in like the board of trustees at Head-Royce or just other sort of things outside of healthcare? Do you have that same sense of wanting to increase care and belonging in community for those activities as well?
That's a really great question. Thanks. For me, it's that we have to remember that whatever we're doing, it's about taking care of people. And being a trustee is about making sure that we can provide the entire community, the entire school community, with the resources so that you all can learn and grow and develop into successful adults. And by the way, not define what successful is for the group, but allow each of you and help each of you the opportunity to define that for yourselves, which again goes back to caring for people, right? There's something so fundamental to that concept, whether it's education, whether it's healthcare, and on and on. And to the extent that we're able to remain focused on that as the foundation for why we do what we do, that's where it comes together for me.
Yeah, and I guess more on that aspect of like success. A lot of Indian American kids grow up hearing things like doctor, engineer, or bust. I guess like how do you think that families, from your perspective as like on the board for the school as well as like actually being in healthcare, how do you think families can sort of support ambition without limiting it? And was there like a moment from your childhood where being Indian American shaped how you maybe saw yourself or just saw what you wanted to do or when you grew up?
Well, let me start at the beginning there, where you were talking about so many of us end up being doctors or engineers. Part of that is we grow up and aspire to a profession and a career based on what we know. And so if you look at, I mean, I think it's a little bit different now for your generation, but if you look at my generation, we were kids of the immigrant population from the 60s and 70s who were primarily physicians and engineers. And so what we saw when we went to our friends' houses, what we saw at home, what we saw at dinner parties were doctors and engineers. So we were heavily influenced in our choices because of that. Now, it's also true, as you said, as you alluded to, that, as our parents, because that's what they knew, steered us into that, right? But even if you look outside of our community, it's very common for kids to grow up and have an interest in whatever it is their parents do or their aunts and uncles and so forth and so on. So it's not necessarily that we only are having our kids grow up and be doctors and engineers. If you look, however, at now what's happening, there's been a huge diversification, right? People are spreading out and doing a lot of different things. Certainly, there are plenty of doctors and engineers still in my generation. Those of us who were born and grew up here, they're a good chunk of us. Obviously, I'm an example of that. But it's, I didn't stay on that traditional path, right? I practiced for almost 10 years. And along the way, I came to realize that there is a need for people who understand the clinical medicine, but also know how the business of healthcare works to be able to then bring those worlds together and create a more successful healthcare delivery system. And that's just one example. But the important piece of that is I'm not a practicing physician anymore. That was a shift, and so I don't really fall exactly in that paradigm. I think it's a really, really interesting time. What I think really defines our community is an ability to take risk, to go out there and say, there's something better for our family, our community. If you look at what's happening now, I think it parallels in some ways what the people in my parents' generation did. They left good lives in India. They said, we're gonna go and we're gonna take a risk and go to this new country with the belief that there's something better for our family, and we're gonna build on the success even more. And it was a huge risk to take. And so now we see that where you've got people who go and they make a run for it in a startup, and they're willing to take that risk because at the end of the day, that's a big risk. Or any number of things, right? And we're seeing that allows, as long as you're mindful of the actual risk and you have confidence in your ability to succeed and you work hard, those are the ingredients then, I think, that creates a broader success across the community.
Yeah. So that's a great answer. I guess like so if high schoolers today wanted to continue to shape the future of healthcare, take those risks, etc., even if they don't become doctors, what roles would you say are like really, really key and that people could start to play?
Healthcare needs talent across the spectrum, whether it's in computer science or in the clinical side. Certainly, health systems being run by people who are very astute at leading and who are able to bring, first and foremost, a focus on better care as the goal, and then building the operations and the finances to solve for that. There's so much that can be done, and that's not even taking into account pharmaceutical drug development, biotech. There are all these different things, and so if the goal is to improve the healthcare system, what I would say is, if you're passionate about healthcare and you're passionate about something else that is in this very broad field, then that's what you should do. Because it's the case that within healthcare, there's a lot of talent on the clinical side. And then I think we're still trying to figure out how to build robust other portions of the business, which we haven't historically put as much resource into to be successful. I mean, if you think about my IT department here, they are very talented, wonderful people. They are basically a support department in that they're mostly running defense, right? Well, what happens if you flip that to, let's figure out how to be proactive? How do we take IT and healthcare and make that part of the value proposition? That's a very, very different approach than historically what we've done in healthcare. And it's going to be transformative, whether it engages AI in an effective way or something else that I don't know about yet, right? That we haven't thought of or whatever it is. But there's a lot that can be done in healthcare that's beyond the clinical side, and that will still impact that clinical delivery very positively.
Yeah, so I guess you mentioned AI, more on that. I guess like how do you think AI might change the emotional side of healthcare? I know it definitely has a lot of influence on like the clinical side and the technological side, but I guess like the more personal part of caring for people and fostering that community, how would you say that AI might benefit that or impact that?
That's going to be an evolving question, or the answer is going to evolve, right? When I look at AI today, AI's real value in healthcare at the moment is to take people back to the bedside, giving them back time to be able to engage in that very human way and practice the art of medicine. Take some of the burden of, let's say, charting through AI, so you're not sitting there charting, you're actually talking to the individual. You today can do those things. You can even take some of the problem solving out of the realm of that and allowing the conversation human to human occur, so that you've got a backup AI solution that's making sure that you've got the power of all that data in addition to your experience and the humanness of the contact that you can bring. In the future, I don't really know what that's going to look like, but I hope that's the path that we continue on, because it can become easy in the name of a more effective business model to solve for people being able to see more patients because they've got AI assistance, rather than to allow them to focus on that patient care aspect primarily.
I see. So it sort of will get the minor things done so that we could prioritize, or so that healthcare leaders could prioritize the more personal sides of care.
That's my hope. That's where I think we should go, is really to bring people back to the bedside. Charting is something that we all have to do, but is that strengthening the relationship with the patient? Is that giving the patient time to explain what their concerns are in a way that, allows you to really engage with that additional insight into the problem solving? No, it's basically creating a medical record so that we've got that to circle back to. And to the extent that we can move that out of the realm of the work that has to be done by the folks that are taking care of patients, I think that's going to make it better.
So in that case, what qualities would you say that future and current healthcare leaders will need that weren't as important, let's say 20 years ago?
I would like to believe that even 20 years ago, we still cared about the patient care aspect. What's happened over time is the administrative burden of taking care of people has grown so much. And so to be able to take that administrative burden into the background and allow the reason people went into clinical care to be the real part of what's happening, that's the shift. I don't know that it's that there's a dramatic change in what drives people to go into medicine. It's just allowing that to be the bigger part of the day, if you will.
That makes sense. So I guess I want to learn more about sort of what influenced you to want to go into medicine. Was there like a particular experience in high school or college? I know you mentioned the fact that like a lot of the Indian American adults are doctors, engineers, etc., which then sort of influences their kids to take up similar professions. But was there like a specific event or a club or experience you had that really made you want to take that risk and go into caring for people?
When I was a pretty young kid, one of my really good friends' dad had just finished his cardiology fellowship, and he was diagnosed with a brain tumor and subsequently died from that. And I couldn't understand how somebody who was in healthcare, who had spent so much time training to become a cardiologist, with all the contacts in his network, the other physicians that he spent so much time with through his training, still ended up dying from this disease at such a young age. And so that's when I first really thought, okay, clinical medicine seems like something that there's a lot of opportunity to do better, because there's something here that I'm not understanding, whether that's because I'm a kid or because it's just not understood. When I got to college, I knew that I really liked science, especially the life sciences. So I spent some time in labs. And what I discovered through that experience is that I was on the right track with the science, and I really was missing that human aspect. So ultimately, that's what led me to apply to medical school, and it connected back with that earlier childhood experience.
Yeah.
Yeah, yeah.
So would you say that being an Indian American in healthcare leadership gives you sort of a different perspective than some of your other peers?
I do think that it's interesting because so many physicians in this community, certainly, but across the country, are of Indian descent. Still, relatively speaking, the leadership positions tend to not be as that we're not as well represented in the leadership positions. Certainly not reflective of the medical staff population, but it's shifting.
So we were talking about success earlier. I guess like what is something about success that you think young Indian Americans often sort of misunderstand? I know we were talking about like the idea of having to be what your parents are that might arise in a lot of Indian American families. Would you say that there's sort of anything else related to like external factors influencing what one's ideal of being successful is?
A lot of external factors influence that, and a lot of internal factors, right? Especially when we talk about the subset of folks who are in, for example, an independent school, and a fairly pricey independent school. It's very easy to define success. It's easy to fall into the trap of defining success as an economic success. And, that's, I think, something that everyone has to be cognizant of. That's not to say that's bad, but that's not the only definition of success. And it is my experience that if you do something well, the money will follow. If you just try to do something for the money, that may or may not be the case.
That seems like a really good way to interpret that, interpret like how to lead one's career. I guess like, so what are some of the things you have to tackle when it comes to like being in a leadership position within like within like an educational institution like Head-Royce?
When we're looking at, from the board standpoint, what we're really looking at is how do we ensure that strategically the school is continuing to excel in helping you all grow, learn, find what you're excited about, find where you're going next, right? I mean, these are really, really big things. And in this day and age and in the future, the board's responsibility is to ensure that the school is able to continue to do that and do that really well. That's the value that the school brings. And so it means having a lot of different experts at the table, right? We all bring very different backgrounds to the conversation. And some are actually from the educational space, and many of us are not, so that we've got these different viewpoints to be able to help inform how that strategy is crafted, and then supporting the administration so that they can also be successful in executing on that strategy. They're part of the development of the strategy and then executing on that strategy.
I see. So like several different lived experiences sort of influencing and coming together to like I guess deliberate on how the educational institution can be set up and how things are executed and developed. That
That's right. It's always helpful in my experience when you're trying to solve problems to have a diversity of opinion at the table. If you have a bunch of like-minded people or people who are just going to say yes to whatever somebody throws out there, the effectiveness and the sustainability of that organization is going to be limited. We want to have different viewpoints. We want to be able to think about things from different angles. We want people to view the problem from their own perspective, which is distinct from the persons on either side of them and across the table from them, so that we can really think of a strategy and a direction that is the most likely to be successful in an environment that in a future where we're not actually sure what that future is going to look like.
Yeah. So like, yeah, I definitely agree. Like the diversity of thought and diversity of opinions and having discourse across difference is really the most practical way I'd say to move forward and actually generate missions and values. So I guess, do you have any specific pieces of advice for someone trying to figure out like who they should be culturally and professionally? Like what would that piece of advice be?
Try different things, try lots of different things, do things that make you a little uncomfortable, and figure out what you really enjoy. It's hard to know what you're going to enjoy in a decade or 2 decades or 5 decades, but to the extent that you can identify right now what things really get you excited, allow that to guide your thinking. The balance there is you've got to make sure that, at some point you can't do everything. You can't try everything, right? So you want to be you have to prioritize a little bit. But I think I don't know that we try enough stuff. I don't know that we move outside of our comfort zone enough. And then when I think back to when I was making decisions about what I wanted to do with my life, these paths are so lengthy and rigorous that it's very easy to just get on the path and have that tunnel vision that that's the path you're going on. I'm very lucky. I love what I do, but I wasn't really looking that far outside of life sciences. I, I just wasn't exploring enough as I would encourage somebody today to do, because I think it's fun and exciting, and that's part of growing up.
Yeah, part of life. I guess,
And just one more thought there, which is I think it's very easy to assume that the job on the other side of whatever it is, right? High school, college, graduate school, or whatever. I picked all the traditional ones, but is already defined. And I don't know that that's true for your generation. I think that's still a question. And so, to the extent that you're willing to figure out what it is that you want to do, what that job is going to be, and then find the job that fits those specifications instead of solving for fitting yourself into the job. I think that's an opportunity that you all will have. We probably did in my generation too, and just didn't know it.
why would you say that opportunity is like, I guess, more prevalent and more available now, where you can sort of have a bunch of interests and then look for a career that closely matches that instead of, yeah, trying to box yourself into whatever you think is like a good career.
You actually, with one of your questions earlier, I think shed light on that perspective. If you are really passionate about healthcare, but you want to be you also really love tech and you think AI is absolutely something you want to be involved in, instead of applying for an IT position on my team, you can say, all right, I'm going to figure out what I'm going to do in AI that's going to make healthcare better. I'm going to design that job and I'm going to go do it. And I'm going to then show up at a health system and make that health system better. Right. And that's just,
Mhm.
it's a very different, it's coming at it from the other side.
Yeah. So more opportunity to like innovate and actually go out and fix the things that or identify problems and then solve for them. That I definitely agree that that's more available now, especially given like the mix of AI and the ability to mix different interests.
Yeah. And also just being comfortable with the idea that you can go and it is worth saying, this is what I want to do. This is what I want my day-to-day job to look like. And then figuring out where that job is rather than going and finding a job and squeezing yourself into it.
Yeah, that makes perfect sense. Were there any pieces of advice that maybe you received from an elder in your family that sort of blends that like wisdom of knowing your values and knowing what you want to do with the practicality of American life and just like going out there and getting things done and creating?
One of the things we talked about earlier, and it probably was early in high school when somebody said to me, go out there and do something where you do a really good job and the money will follow. And that
I'd say,
I think
yeah, that, yeah,
there's a lot of truth to that statement. And some of it is because you're just more engaged and willing to work harder when it's something that when that's what your focus is, right? And doing that well. And if you think about that concept, it applies to pretty much anything you want to do.
yeah. So do what you love and then the money will follow instead of having this mindset of I want to get money, so I'm going to try to fit myself into whatever I think would do that.
Do it well and
Do it well.
yeah, do what you love, right? It's really because if you dabble in something, I'm not sure that that's going to work out, right? But you have to, I mean, you want to do it well. Ultimately, what does that translate into? It means whatever it is you choose to do, you're still going to be doing it as a top performer. And if you're a top performer, typically the money follows.
Yeah, that that makes a lot of sense. And I think that's like a great piece of advice. And I guess to sort of conclude things, what would you say, or how would you say that being Indian American has been sort of like a secret superpower in your, not just in your career, but throughout your life with the multitude of things you do? How has being Indian American sort of served as like a superpower for that?
One of the pieces is being comfortable with the idea that we're it takes hard work to do just about anything. I think another part of it is when things aren't going our way, it's pretty common to just put our heads down and work harder and not spend a lot of time complaining about it. That has its drawbacks as well, but certainly from a professional standpoint, I've found value from that. And then it's that willingness to take risk and have confidence in oneself that you're going to figure out how to make it work. It is the balance of knowing when to quit, to take a risk, to go do something else, and then persevering appropriately to be successful in that.
I see. So sticking to your values and trying to do what you want to do, but also knowing like that you do need to do that commitment and pivoting when it's needed. That makes
Yeah,
a lot of sense.
all of us are going to make decisions that aren't the right decision. I mean, right? That's the reality of it. And that is true even at the level of career and so forth and so on sometimes, right? And so you've got to be comfortable with the fact, I think, that it's okay to make those mistakes. It's okay to try something, even if it's something as big as your career choice, and say, okay, but that's not exactly what I thought it was going to be. Let me try something else.
That makes sense. Yeah, and I guess we can end our conversation today with like a few rapid fire questions. I guess like has there ever been a time when you felt like you were caught between two worlds and how did you navigate that moment?
I always feel like I'm caught between multiple worlds. The reality is that in America, I'm not treated as an American because I don't look like an American. When I go and visit people in India, they know immediately I'm not from India. So the reality as an immigrant, even one who was born here, is I don't actually belong in many people's eyes here, and I don't belong there. I'm a physician in a world that's largely inhabited by folks with masters in health administration. They are skeptical that a physician could possibly know how to run a business, let alone a hospital or health system. And so I'm facing that all the time. I've had people say straight to me, well, I've never met a physician who can actually run a health system. And then say, but it seems like you've figured it out, right? So I think we're all frequently caught in those situations.
I see. So there's like that's interesting. So there's that layer of like even though you are all like within the same industry, there is a layer of like your degree and like what you were before or like what role you had in healthcare before you got into leadership.
In particular, I think people are skeptical of physicians being able to do these types of roles.
I see. Is that so it's not very common for physicians to sort of be in administration?
It's actually not very common at all. It's changing. It's changing very slowly. Today, across American healthcare, about 20% of CEOs are physicians. That's the highest it's been. And what's really interesting is if you look at the outcomes that physician-run hospitals and health systems have, they tend to be better in terms of quality and financially than non-physician-run systems. But it takes time. It takes time for that change to occur. It is occurring, but 80% not run by physicians, right? I mean, that's a big difference.
Is part of that efficiency the like the idea of like having hands-on experience with patients and like getting that human-centered aspect more right there and like I guess personally is part of that kind of influencing the efficiency of being a physician in administrations?
That and also understanding what what it means to be a physician in practice, like there are a lot of components to where while you don't have to know how to practice medicine to be able to lead an organization that provides healthcare, if you can do that, and if you can bring that to the conversation while also remembering to allow operations to support that, the finance to support that, if you can do all of that together, having that clinical background and that experience is incredibly valuable.
That makes sense. Have you ever had to like downplay your Indian identity at all? Or like whether that be going to India and like being like I guess too not Indian or being too American, have you ever had to downplay like being American or like on the other side of it, you mentioned like being viewed as Indian here as like sort of this sort of stigma around that. Have you ever had to like downplay or like reduce part of your identity?
That's a tough question because I don't know that I can. If you know my name, if you look at me, you know I'm of Indian descent. And there's really, I mean, how does one downplay that? I don't know the answer to that question. I think I more likely what happens is you just kind of we roll with it and we go on to the next opportunity knowing that it's not going to matter because what's going to matter is the quality of the work that we do and the value we bring to the organization. But you know, it's
So if you could magically help everyone understand one thing about like Indian culture or moreover like being Indian American, would that be it? Or
but that's not just an Indian culture thing, right?
yeah,
That's
yeah.
your question really touches, at least as I interpreted it, on bias in hiring and the workplace and beyond. And in many cases, racism is kept behind like you don't nobody's overtly well not nobody unfortunately these days it's more overt but for the most part racism is not overt and so you don't really know if somebody's making a decision or choosing to downplay the input that you have for reasons that are due to their own bias whatever that
Yeah.
bias is right whether it's because I'm a physician leading a health system and hospital, whether it's because I'm of Indian descent, there are all sorts of reasons why it could be, and you just don't know.
And there's no
So,
yeah, and there yeah. Or
and so the
sorry, go
important
on.
thing is to make sure that, and what is very typical is right. So that's why we will make sure I will make sure. Okay, well, what can I do better next time? What are the things that I need to do to make sure that I am bringing value? How do I work harder, and so forth and so on? Right? That's the solution because you never really know what the issue was, and so you want to try to find those things that you have the ability to change that you can.
That makes a lot of sense. And
And
is
I remember, and it wasn't even that long ago. It was maybe 30 years ago. I was driving in Walnut Creek and somebody told me to go back to where I came from. And I was so confused, right? Because I thought I was born, as I mentioned earlier, in New York City. And I was like, this person wants me to go back to New York City. That's weird. But right, I mean, sometimes it's overt, most of the time it's not.
so when someone asks something like that, like where are you really from? Like how do you respond to that? And then is there an answer you wish you could say but you don't respond with?
I've gotten to a place where I usually just so I assume people are asking that with the best of intention and curiosity, and so I will usually ask the question back, what exactly are you asking me for? Are you asking me where am I from, as in I live in Oakland? Are you asking me where was I born? Where did I grow up? Are you asking me where my parents are from? So I'll usually turn it around and ask that question to get clarification.
Yeah. No, I think that that's the way to go when someone asks that. Because it's often not always like a backhanded question. So it's good to get that clarification.
And
Um,
it's
yeah.
frankly healthier for me to assume that they're asking out of curiosity, right?
Yeah.
Because otherwise, I'm internalizing all of these assumptions that they're not
It just
adding any
clogs up
value.
the brain. Yeah.
That's right. That's right.
Is there like a family tradition that your parents insisted on that you didn't really like to do growing up, but now like you look back and secretly love it?
I mean, I don't know that it's secretly, I think there are a few things. We used to go to the Livermore Temple a lot growing up, and we certainly don't go as much these days. But there's really something pretty special about that place and the fact that we have it so close and it's so accessible. And so that's been cool to see. Like many families, we grew up eating Indian food essentially all the time. And now it's such a delight to be able to do that. Whereas a kid, I didn't think twice about it. And certainly there were days where I was thinking, can I just have a hamburger or lasagna? But, I mean, I imagine a lot of us have those types of experiences.
No, yeah, I feel that way about the Jain temple in Milpitas. So
Yeah. It's amazing, right? It's amazing that we have all of these great resources and they're pretty close by.
I know, yeah. It's often underappreciated, but like the Bay Area has a lot of Indianness to it that many other places don't have.
Even other parts of this country where there's a sizable Indian population, when you go to New York, New Jersey, there's a lot again, but a lot of the rest of the country, that's not really the case.
Yeah. I guess is there something that like non your non-Indian friends when you were growing up would sort of like see or like laugh at that you would have at home that you didn't realize was like different?
I don't think I had friends who laughed at anything that was happening in our house or in our lives. And part of that is because, growing up in the outer East Bay, there was already enough diversity that many families had different ways of doing things that were not the TV norm, if you will, what you saw from the television family.
Yeah.
And so I think that helped a lot. And that's probably part of just the Bay Area bubble.
Yeah. So like I guess less like making fun of, more like there might be something surprising, but not like in a negative way.
Yeah, I mean, most of my friends were thrilled to be able to come over for dinner and eat Indian food, and that they loved it. They still do.
Yeah. To end things off, what's the most stereotypically Indian thing that you can't live without?
We still follow a lot of the traditions, not nearly as much as when I was growing up, but there's still sort of stereotypically Indian things like I mentioned going to the temple is one example of that, right? I think Diwali is a great example of a fairly stereotypical Indian thing, but also that's very much shifted even over the past decade here in this country to being so much more of a celebration and about a lot of other community type things. So even that's changing.
Yeah, I'd say it's ever evolving.